Welcome to the deep dive. Today, we're embarking on what feels like a really crucial mission to unpack a silent revolution that's unfolding in the realm of brain health. We're sifting through a stack of pretty fascinating sources, trying to pull out the most important insights, to reveal how you can truly optimize your brain.
Hmm.
We want to move beyond those traditional ideas of mental illness to something more tangible and actionable understanding of what genuine brain health means for you personally.
That's a perfect way to frame it.
Yeah.
For, far too long, the conversation around mental well-being has really fixated almost exclusively on symptoms, often without truly looking at the organ at the heart of it all, the brain itself. So our deep dive today, it really aims to fundamentally reframe this discussion. We're embracing a foundational philosophy that views psychiatric conditions not as these abstract, sort of elusive mental illnesses, but as concrete, measurable brain health issues. And importantly, issues that we can both diagnose and treat. It's a paradigm shift, really. One that seeks to pull psychiatry, a field whose outcomes have, surprisingly, remained largely stagnant since the 1950s, into the light of modern evidence-based medicine.
And absolutely central to this new paradigm, I think, is the transformative role of brain imaging. For decades, understanding what's structurally or functionally going on inside our heads has been, completely opaque, like a black box. We've largely relied on questionnaires, behavioral observations, subjective reporting. Think about traditional talk therapy, for instance. It's powerful, no doubt, but it often involves discussing how you feel or what word associations come up, which, while beneficial, can sometimes even, risk re-traumatization by reliving past events without necessarily changing the underlying brain function immediately. But now, with advanced imaging, we can actually see and understand brain function in real time. It moves us beyond just talking about trauma or anxiety to potentially, literally getting the brain circuits to operate more effectively.
Indeed. Yes. And while conventional tools like MRI or CT scans, they excel at showing us the brain's structure. Think of them as revealing the hardware of the brain, its physical architecture. Our focus today is on a powerful and, I think, highly revealing tool called SPECT, which stands for Single Photon Emission Computed Tomography. Now, unlike an MRI, which gives you that static picture, SPECT dynamically assesses cerebral blood flow. Imagine it as a live heat map for your brain. It shows us these intricate patterns of brain activity, whether an area has optimal activity, maybe too little, or perhaps even too much. And this functional insight is absolutely crucial because it reveals how your brain is actually working, not just what it looks like structurally. Most psychiatric problems, as we'll explore, are precisely these kinds of functional issues. It's not necessarily that the brain's physical structure is broken, but rather that the hardware might be perfectly intact, yet it's simply not operating optimally. Like a computer with perfectly good components, but maybe buggy software, right? This functional perspective is what's truly transforming our approach to psychiatry. It offers a path to far more personalized and ultimately effective outcomes.
And what truly underpins this whole revolution, what gives it such a robust scientific foundation, is this incredible resource you mentioned, the world's largest brain scan database. We're talking about a truly vast collection here, over 225,000 functional brain scans, gathered from patients ranging in age from just 9 months old all the way up to 105 years old, and hailing from, 155 countries across the globe? That's huge.
It is immense, yeah. This huge, diverse repository of data, it's the bedrock of a unique expertise.
Mhm.
It allows for the development of proprietary diagnostic and treatment models that are truly personalized. It's this deep analysis of, tens upon tens of thousands of scans that allows for insights that mere symptoms or traditional assessments alone could really never reveal.
Right. And we'll even hear about a compelling case study that illustrates this so powerfully, won't we? This child, Andrew.
Yes, exactly. Andrew's case is striking. Severe, aggressive, profoundly troubling behavioral issues, ultimately traced back via imaging to a treatable brain cyst occupying his left temporal lobe. This was a physical cause, something concrete that traditional methods would almost certainly have missed entirely. After the surgical removal of that cyst, his behavior reportedly returned to normal. It demonstrates with, I think, undeniable clarity the critical importance of actually looking at the brain itself. It's a powerful testament to why we need to move beyond symptom-based diagnoses alone.
Okay, so we've talked about this incredible shift towards viewing the brain functionally and how imaging is central. Now let's really zoom in on the star player here, SPECT. For those listening who might be wondering, what exactly is SPECT? How does it give us this, unprecedented view into the brain's inner workings?
That's a vital question, yeah. So as I mentioned, SPECT stands for Single Photon Emission Computed Tomography. To reiterate that core difference, imagine an MRI giving you a detailed static photograph of your brain's anatomy. Is the structure there? Does it look normal? That sort of thing. SPECT, on the other hand, it's like a live-action video of your brain's activity. It measures cerebral blood flow. And blood flow is a direct proxy for brain activity. More blood flow means an area is working harder. Less blood flow means it's underactive. So it literally produces this heat map of your brain, showing us patterns of activity, whether a specific region has good, healthy activity, too little, or perhaps even too much. This functional insight is absolutely key because it doesn't just show us what your brain looks like structurally. It shows how it's truly working in real time.
Right, the dynamics.
Exactly. To use that computer analogy again, an MRI or CT might tell you if the hard drive is physically present and looks intact, but SPECT tells you if the software is running efficiently. Are there bottlenecks? Are certain programs crashing? Are parts of the system overheating? That functional understanding is what allows for truly targeted interventions.
And that functional understanding, seeing the brain's, let's say, software in action, leads to incredibly personalized insights, doesn't it? It means moving light years beyond a generic one-size-fits-all diagnosis because, as you've said, that approach just doesn't work for the brain. You can't just throw the same medication or therapy at everyone who shares a symptom label and expect it to work out well.
Precisely. You've hit on a core truth there. By looking at these intricate functional patterns, we can identify specific subtypes of disorders that symptoms alone just cannot distinguish. This is the game changer, truly. It allows for a level of precision in understanding an individual's unique brain health that was, frankly, impossible before. This is why, for instance, a broad diagnosis of ADHD isn't nearly enough information for effective treatment. Knowing the specific type of ADHD, whether it's primarily inattentive, hyperactive, or even that lesser-known ring of fire type we'll touch on, as revealed by a SPECT scan, that's what informs an effective, personalized treatment plan. We move from guessing based on symptoms to knowing based on brain function.
Can you give us some more vivid examples, maybe from the thousands of scans you've analyzed? Cases where seeing the brain's function really dramatically changed the approach, or even someone's life trajectory?
Absolutely. The case examples are often the most compelling way to see this in action. Let's take a very public example. Kendall Jenner. After she contracted COVID-19, she experienced this profound, intense anxiety, really debilitating for her. A SPECT scan of her brain revealed something very specific and quite striking. Significant inflammation in her anxiety centers, particularly in her limbic system. These areas were dramatically overactive. Now, for someone not normally prone to such intense anxiety, this immediately indicated a clear, identifiable biological problem. It wasn't just a psychological state. It was her brain that was inflamed, functionally disrupted. It shows that intricate balance between sort of bottom-up biological influences and top-down psychological experiences. The scan provided a clear target for treatment.
Wow.
Or consider the example of someone struggling with severe alcohol use. Their scans often reveal a brain that appears physically older than their chronological age, sometimes by decades. Now, this isn't just a grim diagnosis. It's a powerful, tangible visual motivator. I've heard of a famous musician, Jonathan Cain from Journey. He saw his own brain scan. It apparently showed his brain looked significantly older than it should, largely due to his habit of drinking, I think it was 2 bottles of wine a night. Seeing that objective reality, that physical impact on his brain, prompted him to stop drinking entirely. And apparently he hasn't had a drink since. That visual evidence provided the necessary push.
That's incredible motivation.
It really is.
Yeah.
Even in my own personal experience, seeing my own brain scan, which showed clear signs of damage from, well, past head injuries and some definitely unhealthy habits, and then comparing it directly to my then 93-year-old mother's brain scan, which was stunningly healthy, vibrant, reflecting her sharp cognition. That direct comparison, it was a pivotal moment for me. It made me really want to improve my own brain health. It cultivates what's been aptly called brain envy, that powerful desire for a healthier, more optimized brain.
Brain envy, I like that.
Yeah. And then there's that fascinating anecdote of the couple on the verge of divorce. Their relationship was just crumbling under constant conflict. Their scans revealed an overactive gear shifter, the anterior cingulate gyrus, in the wife's brain. It was literally causing her to ruminate endlessly, unable to let go of past issues. The husband, on the other hand, had low frontal lobe activity, leading to impulsivity, inconsistency, poor follow-through. So instead of just treating their marital conflict with therapy, which hadn't been working, they got targeted treatment for these specific brain patterns. Appropriate medication, behavioral strategies, and it dramatically improved their relationship. They came back a month later, sitting closer, hands touching, and eventually didn't need therapy anymore. It highlighted that it was the brain, not just their willpower, that needed the specific intervention.
That's incredibly powerful, how seeing the physical reality can just shift everything. And this power extends even to something as fundamental as our daily emotional landscape, right?
Yeah.
So let's pivot to a topic everyone can relate to. Happiness and that pervasive influence of negativity bias. What does a brain geared for well-being actually look like on these scans?
Well, our extensive research, including studies we did for a book called You Happier, indicates a very strong, consistent correlation. If your brain is functionally healthy, if its systems are balanced and optimized, you are significantly more likely to experience and sustain happiness. It just works better. Conversely, low activity in the front part of your brain, specifically the prefrontal cortex, is consistently linked to less happiness and a diminished capacity for joy. And this isn't just correlation. It often feels like a causal pathway. A brand new study, just recently accepted for publication, looked at negativity bias and reinforced this finding. It found that low frontal lobe activity not only correlates with unhappiness, but also a heightened, almost automatic tendency toward negativity. This constant negative filter is itself detrimental to brain health, creating this kind of vicious cycle. Now, a certain level of anxiety is healthy, it's protective, right? Enough to stop you from driving 125 miles an hour down the freeway or robbing a store. But chronic, pervasive negativity is a significant problem. We often perceive this as just a lack of mental discipline. But our scans suggest that roughly 70% of these patterns are rooted in identifiable brain function issues, meaning the hardware or software is actually driving the thought process. The remaining 30% might stem more from learned habits or maybe a lack of mental training, but even then, those habits sculpt the brain over time. It's less about blame and more about identifying the root cause to find the right solution.
That makes so much sense, linking thought patterns directly to brain function. Let's apply this lens to something else many people experience or know someone who does: ADHD. For years, it was treated as this single uniform disorder, but the scans, as you mentioned, reveal a much more complex picture.
That's truly one of the most profound lessons we've learned from brain imaging, yes. All psychiatric illnesses, including something as common as ADHD, are not simple singular disorders. They are highly heterogeneous, meaning they have multiple types, each with distinct underlying brain patterns. For example, the classic ADHD pattern often shows, predictably, lower activity in the prefrontal cortex, your brain's brake and attention center, along with reduced activity in the cerebellum and basal ganglia, especially when trying to concentrate. This is the pattern often held by stimulants. But then there's this ring of fire type. It's characterized by high activity across the entire brain, almost like an internal alarm that just won't turn off. For individuals with this subtype, stimulants, often the first line of treatment for ADHD, can actually make them significantly worse. It can increase their anxiety, agitation, even paranoia.
Wow, so the standard treatment could backfire?
Yeah, exactly.
Yeah.
It highlights in the starkest terms why a one-size-fits-all treatment approach is not only ineffective, but potentially harmful. We also see patterns of significant underdiagnosis, particularly in girls. They often don't exhibit the same overt disruptive behaviors as boys.
Right.
They might be more inwardly inattentive rather than outwardly disruptive, making their struggles less visible. And furthermore, the role of diet in ADHD and frankly in overall brain function is critically important. Consider a compelling study from Holland, for instance. It showed that simply eliminating artificial dyes, artificial sweeteners, gluten, and dairy from the diets of children diagnosed with ADHD led to a remarkable 70% reduction in their symptoms. 70%. That powerfully reveals how specific foods can directly impact brain function by acting on delicate neurochemical pathways. For some individuals, gluten can break down into compounds called glutamorphins and dairy into caseomorphins, and these substances can actually act on your brain's OP receptors, essentially creating a mild fogging effect for some, impacting mental clarity and focus, like a tiny unwanted buzz. This isn't necessarily about allergy. It's about how certain foods can literally influence your brain chemistry and thought patterns. So for a child struggling with ADHD, trying focused dietary change for a month or two, maybe under guidance, before resorting to long-term stimulants, it can be profoundly impactful and, for many, life-changing.
That's a powerful connection: diet and brain function. Which brings us neatly to another crucial tool in this whole brain health revolution: the Bright Minds Framework. It's a powerful acronym, isn't it? Designed to help us remember the major threats to our brain health.
Precisely. Bright Minds serves as this invaluable mnemonic. It represents 11 major, often preventable or treatable risk factors that can significantly damage brain function and, crucially, increase the risk of conditions like Alzheimer's disease and other dementias down the line. It's a comprehensive, proactive approach to brain health optimization. This framework doesn't just list problems, it offers simple yet profound advice on how to protect your most vital organ. It's really about empowering you with the knowledge to make choices that support your brain every single day.
Okay, let's break down some of these critical factors and their impact. Starting with B for blood flow. It sounds foundational, which it is, but what are some surprising ways our daily lives can impact this?
Blood flow is absolutely foundational. Your brain, it's only about 2% of your body weight, but it consumes a staggering 20% of your body's blood flow and oxygen. It's incredibly hungry. Low blood flow to the brain can be caused by everyday habits that many people engage in without realizing the impact. This includes consuming too much caffeine, nicotine, marijuana, or alcohol, being overweight, leading a sedentary lifestyle. For instance, compelling studies involving, I think, over 33,000 people have consistently shown that as your weight goes up, the overall size and functional activity of your brain tend to go down. These factors can literally decrease the size and function of your brain over time, leading to less cognitive reserve. Exercise, conversely, is one of the most powerful interventions. It significantly boosts cerebral blood flow, feeding those hungry neurons. This is why physical activity is so important, especially for kids who are increasingly glued to screens instead of playing outside and engaging their physical bodies.
Okay, moving through the acronym, let's jump to T's for toxins. Beyond the obvious culprits like alcohol, what are some of the more surprising brain toxins we might encounter?
Right. Beyond the obvious, like alcohol and marijuana, and studies on marijuana users consistently show significantly lower blood flow across every area of the brain, making their brains look older, there are surprising toxins lurking. In our environment, even in medical settings, take general anesthesia, for example. While sometimes necessary, of course, studies show that even a single dose can increase the incidence of ADD and learning disabilities in children. And a single dose in adults can raise the incidence of dementia. The worst effects often seen after complex surgeries like coronary artery bypass. Patients rarely consider the critical need for brain rehabilitation afterward.
That's really sobering.
It is. And environmental toxins are huge. Mold, for instance. We saw this vividly in cases like Dave Asprey's. His brain scans were initially described as moth-eaten due to mold exposure, then dramatically improved after a dedicated detox protocol. Heavy metals like lead and mercury, often found in old pipes or certain types of fish. Even poor indoor and outdoor air quality are significant threats. So actively supporting your body's natural detoxification pathways through consistent hydration, a diet rich in fiber, and even regular sauna use, which helps you sweat out toxins, is absolutely vital for brain resilience.
And then M for mental health issues. This seems a bit circular for a brain health framework, given that mental health is what we're ultimately trying to improve. What's the key insight here?
Good point. This M highlights the profound, tangible impact of psychological states like chronic negativity bias, feelings of low hope, and, crucially, adverse childhood experiences, or ACEs. We've dedicated extensive research to this, including a huge new study on 7,500 patients, examining how many bad things happened to you growing up and their lasting physical impact on your brain. The ACE questionnaire covers a range of traumatic events: physical, emotional, sexual abuse, neglect, witnessing domestic violence, or having a parent with severe mental health issues, incarceration, addiction. Chronic stress resulting from ACEs can literally, physically rewire the emotional brain. It makes individuals hypervigilant, constantly watching for something bad to happen. This sets up a profound negativity bias, and the data is stark. The more ACEs an individual has, the higher their risk for major health problems, heart disease, cancer, and even a significantly shortened lifespan. People with 7 or more ACEs can, on average, die 20 years earlier.
2 years, wow.
It's a powerful, undeniable example of how an experiential, sort of top-down narrative can functionally change the very architecture and activity of the brain. And it's not just personal direct trauma. Even the passive consumption of negative news can induce more signs of PTSD than actually experiencing a traumatic event firsthand. A chilling study on the Boston Marathon bombing showed this. The constant bombardment of negative, often sensationalized information designed specifically to hook your attention actively harms your brain. It's like a silent assault on our neural pathways.
That insight about negative news is particularly unsettling in today's world. Okay, so with these major threats identified through Bright Minds, what are the actionable steps? What can we do? Let's start with cognitive restructuring, what you call killing the ANTs. How do we begin to implement that?
Right? ANTs, automatic negative thoughts. Learning to manage them is a crucial top-down approach to brain health. And let me be clear. While it's undoubtedly harder to manage ANTs if your brain's hardware isn't right, you typically get more ANTs when you're tired, hungry, stressed, even premenstrual, as low blood sugar can trigger them. Everyone experiences these intrusive, often illogical thoughts. A powerful technique, and one you can use immediately, is to externalize these thoughts. Give them a name, maybe. Like my own personal analogy, call me Hermie the raccoon. He's just this mischievous creature causing trouble in my head. This act of externalization creates crucial psychological distance from the internal noise. You recognize it as just mischief, not your true self. The core principle, which I really can't stress enough, is don't believe every stupid thing you think. Your brain is a thought factory, and frankly, not all its products are high quality or even useful. A great practice is to consciously start your day with positive intentions. Today's going to be a great day. Beyond that, actively train your brain to look for micro miracles throughout your day. It could be spotting an unexpected hummingbird, noticing the intricate pattern on a leaf, getting a thoughtful text, anything. This simple, daily shift retunes your neural pathways to a more appreciative, positive default. It teaches your brain to scan for what's right in the world, not just what's wrong.
Yeah, I love that. Micro miracles. Okay, and for something deeper, often debilitating like trauma, eye movement desensitization, and reprocessing or EMDR has been truly transformative for many. Can you explain how it works? What makes it so effective?
Yeah, EMDR is a highly specialized psychotherapy. It was developed specifically for emotional trauma and PTSD. It's based on the understanding that traumatic memories, unlike regular memories, can get stuck in the brain's natural information processing system. They stay raw, vivid, emotionally charged, almost like they're happening right now. Through bilateral stimulation, which can involve guided eye movements or holding little pulsars that create alternating vibrations in your hands, or even auditory tones while recalling a traumatic memory. EMDR helps to activate the brain's natural healing mechanisms. It's almost like jump-starting a computer that's stuck in a loop. It helps the brain process the memory, reduce its emotional charge, and finally integrate it into a calmer, more adaptive part of the brain network. Our own SPECT studies on police officers with PTSD, for example, showed not only remarkable symptom relief after, I think it was an average of just 8 EMDR sessions, but also significant measurable improvements in brain function. We observed the brain's diamond pattern of trauma, characterized by widespread hyperactivity, literally transform into a calmer, more organized state. It's really quite remarkable how it works. The eyes, being the only uncovered part of the brain, offer this direct pathway to unlock that chronic hyperactivity. Even simple walks, with the natural bilateral stimulation from the passing scenery, they mirror this effect and can be incredibly therapeutic for just general stress reduction.
Fascinating. Beyond these specific therapies, though, lifestyle interventions are absolutely key, aren't they? It's not just about targeted treatments, but this holistic, everyday approach.
Absolutely. The guiding question, the one that should echo in your mind every single day, applied to every choice, should be, whatever I do today, is this good for my brain or bad for it? This simple question is a powerful filter. Exercise is vital, and I mean more than just a leisurely stroll. Walk as if you're slightly late, get your heart rate up. Even better, incorporate coordination exercises. Table tennis is excellent for the brain, requires eyes, hands, feet all working together, challenging multiple neural networks. Continuously learn new things, keep your brain engaged, forming new connections. A new language, a musical instrument, a new skill, anything. Prioritize good oral hygiene, daily flossing. Periodontal disease, unhealthy gums, is a major, often overlooked cause of inflammation that directly impacts your brain. Know your genetic predispositions for obesity, heart disease, cognitive decline. Use that knowledge to create daily prevention programs tailored to your risks.
Right, the genetics as a wake-up call.
Exactly.
Yeah.
And proactively avoid head trauma, especially for children. Don't text while driving. Reconsider sports like tackle football or heading soccer balls, particularly for young, developing brains. Minimize your exposure to toxins. Actively support your body's detox pathways. Hydration, fiber, maybe regular saunas. Make conscious dietary choices. Eliminate processed foods, sugar, gluten, dairy. All can inflame the brain, disrupt its chemistry, and crucially, consciously manage your sleep. Getting 7.5 hours of quality sleep turns on something like 700 health-promoting genes. Less than 6 hours turns those same genes off. It's about prioritizing sleep to allow your brain to wash itself of metabolic waste and consolidate memory's vital functions only happening during deep sleep.
Okay, that's a lot of great actionable advice. Many of our listeners I know struggle with anxiety. It's so pervasive. What are the biggest do's and don'ts for managing it, especially in the moment when panic strikes, when that feeling of dread just washes over you?
That's a critical question. First, and this is very counterintuitive from any experience, don't leave a situation when you feel panic. If you flee, anxiety begins to control you. It teaches your brain that escape is the only way to cope, which often leads to the anxiety expanding its territory, making your world smaller. Staying in the situation, even just for a few more minutes, working through it, prevents anxiety from taking over. Second, master diaphragmatic breathing. Breathing from your belly, not shallow chest breathing. The 15-second breath, that's 4 seconds in, hold for 1.5 seconds, 8 seconds out, brief hold at the end, can literally break a panic attack in minutes. It directly stimulates your vagus nerve, calming your nervous system. Studies show it can be as effective as certain medications like Xanax, but obviously without the side effects.
15 seconds, 4-inch hold, 1.5, 8 out, hold. Got it.
Exactly. Third, write down your scary, anxious thoughts. Externalize them. Get them out of your head onto paper. They lose some power that way. And learn the 18-40-60 rule about what others think of you. At 18, you worry what everyone thinks. At 40, you don't give a damn what anyone thinks. And at 60, you realize no one was thinking about you at all. It's a wonderful perspective shift, especially for social anxiety. Finally, hypnosis, often misunderstood, is remarkably effective for calming anxiety and retraining the subconscious mind. When it comes to medication, it's crucial to be thoughtful. While there are effective treatments, benzodiazepines, for example, often prescribed for anxiety, are associated with addiction and increased dementia risk over time. They should be used with extreme caution, ideally not as a first line of defense. There are safer, effective alternatives.
That's really helpful advice. Okay, we've covered mindset shifts, therapies, lifestyle changes, but there's also the question of targeted nutritional support. There's so much information out there on supplements, it can feel overwhelming. What's actually beneficial versus just hype? As we wrap up actionable steps, what are some absolute must-haves foundational supplements for brain health?
You're right, it can be a minefield. But some supplements truly stand out as foundational. First, omega-3 fatty acids, specifically EPA and DHA. Your brain is about 60% fat, and a significant chunk of that is DHA. They're absolutely crucial. Most people are deficient. Research consistently links higher omega-3 levels to larger hippocampal volumes, your memory structure, better abstract reasoning, improved mood, memory, reduced inflammation, even pain. Second, saffron. This spice is a potent natural mood enhancer. It's been shown in, I think, over 26 randomized controlled trials now to be as effective as common antidepressants, with fewer to virtually no side effects, and it even supports healthy sexual function, which antidepressants often hinder.
Saffron, interesting.
Yeah. Third, L-theanine, an amino acid found in green tea. It promotes a calm, focused state without drowsiness by increasing alpha brain waves. Excellent for managing anxiety and improving attention. Fourth, magnesium. This mineral is essential for over 300 biochemical reactions in the body, and many people are deficient. Different forms target different needs. Magnesium glycinate is great for sleep. Magnesium taurate can help with muscle twitches. Fifth, a high-quality multivitamin. Ensuring adequate levels of vitamin D. Low levels are linked to so many mental and physical health problems: B6, B12, and folate. Specifically, methylated forms of B vitamins are important if you have certain genetic variations affecting absorption. Some people even need B12 injections for optimal levels. Other beneficial ones to consider, depending on need: ashwagandha for calming and testosterone support, curcumin for powerful anti-inflammatory effects, and specific smart mushrooms like lion's mane or reishi for cognitive and immune support.
This is truly fascinating territory we're moving into now. How do men and women's brains genuinely differ? And what do these differences mean, not just individually, but crucially for our relationships?
Yeah, our extensive scan database reveals clear and consistent differences between male and female brains, and they are deeply impactful. Generally, women tend to have healthier brains overall. They often exhibit better frontal lobe function. This likely contributes to lower rates of incarceration compared to men. Women go to jail about 14 times less often. However, their emotional brains, particularly the limbic system, are often significantly busier. This leads to higher tendencies for rumination, increased anxiety, and depression. Things like regular exercise and consistent bright light therapy can be very helpful in modulating this heightened limbic activity. Men, conversely, often show lower prefrontal cortex function. This correlates with higher rates of ADD diagnoses, more impulsivity, increased risk-taking behavior. They tend to drink more, engage in contact sports more often. But men also tend to have more activity in the cerebellum, linked to coordination and a more narrow, focused vision, while women typically excel at peripheral vision, literally seeing more of their environment. These differences even extend to memory. Women often have a larger hippocampus, the major memory structure, meaning they're frequently more likely to remember hurtful words or past grievances in relationships.
Okay, so understanding these fundamental neurological differences, what have the scans and your research taught you about the intricate dance of love in the brain? How does brain health really intersect with our most intimate connections?
It's a profound revelation, really. But simply, it's just easier to love someone whose brain is reasonably healthy. so they tend to be more reliable, predictable, consistently trustworthy. When the brain isn't healthy, say, low frontal lobes causing impulsivity, inconsistency, poor judgment, or an overactive emotional center leading to chronic grudge-holding and reactivity relationships inevitably suffer. That earlier story of the couple on the brink of divorce, where the scans revealed the wife's overactive gear shifter and the husband's low frontal lobes driving their core conflicts, and how targeted treatment saved their marriage. That's a powerful illustration. From a neurobiological perspective, understanding these underlying brain patterns means judgment can give way to effectiveness. We move beyond blaming the person to understanding the underlying biology. For instance, issues like domestic violence often involve profound underlying brain problems in one or both partners, head injuries, substance abuse, obsessive thought patterns. Recognizing these neurological roots can foster far more compassion and lead to truly effective interventions, moving beyond just moral condemnation to seeking practical solutions.
That reframes so much. Given this understanding of neuroplasticity, the brain's incredible ability to change, can we actually rewire ourselves or even influence our partners to be better in relationships? Is it truly possible to consciously shape our brains for more loving, supportive connections?
Absolutely. Neuroplasticity isn't just a scientific concept. It's a profound truth that applies directly to relationships. Your brain changes and adapts based on what you continually pay attention to, what you practice, what you reinforce. You can consciously shape your brain for better relationships. A great starting point is a simple but powerful exercise called the one-page miracle. Clearly define the kind of relationship you truly want: kind, caring, loving, supportive, communicative. Write it down, visualize it, work towards it daily. Understanding the neurological underpinnings of complex issues, like we discussed with domestic violence, linking to head injuries, substance abuse, obsessive patterns, it moves us beyond simplistic judgment to more effective, compassionate solutions. Even something as fundamental as sexual intimacy, which profoundly impacts connection, relies on healthy brain function and good communication. It involves a complex interplay of oxytocin for bonding, dopamine for pleasure, physical stimulation. We can clearly see how external factors, like excessive exposure to pornography, can alter brain expectations, setting unrealistic standards and contributing to communication struggles in real-life relationships. Similarly, our inherent brain chemistry and past experiences often subtly drive our choice of partners. It can lead some individuals to be repeatedly attracted to troubled partners, maybe unconsciously trying to fix a perceived deficit in themselves, often stemming from unresolved past trauma. And then there's intense, often unidirectional infatuation, known as limerence. SPECT scans can show patterns of hyperfrontal activity strikingly similar to OCD, highlighting how fixed, obsessive thought patterns can completely dominate focus and judgment. The fascinating, often overlooked link between seemingly simple physical infections like strep throat and the activation of an obsessive brain pattern leading to new-onset OCD. Even substance abuse, in some cases, just underscores this immensely complex interplay between our physical health, our brain's wiring, and the dynamics of our most important relationships.
This whole deep dive has truly unpacked this revolutionary idea that the brain isn't static, set in stone, but rather capable of profound, continuous change. This points directly to neuroplasticity, and for our listeners, I think, immense empowerment.
That's precisely it. Your brain is soft tissue, but your skull is hard bone with sharp ridges. What you continually pay attention to, what you feed your mind and body, whether it's positivity or negativity, healthy habits or an addiction, actively reshapes your brain. Neuroplasticity is real, but it's not always for the good. It depends entirely on where and how you direct your attention and energy. That concept of brain envy, that powerful desire for a better, healthier, more optimized brain, can be an incredibly potent motivator. And a crucial takeaway: genetics are not a death sentence. They're a powerful wake-up call to action. They inform you of your predispositions, guiding you to implement a targeted daily prevention program. The overarching message here is one of incredible empowerment. You absolutely can make your brain healthier, more resilient, and more effective.
So, as we wrap up this truly enlightening deep dive, what's the final thought, the ultimate piece of wisdom you want to leave our listeners with as they consider their own brain health journey?
The single most important question to ask yourself every day, maybe multiple times a day, is this: whatever I do today, is this good for my brain or bad for it? This simple question, when answered honestly and with information and with self-love for yourself, your family, your purpose in life, is the direct pathway to a healthier brain. And, by extension, a much better life. We absolutely must discard the notion that we need to engage in harmful behaviors to have fun or to cope. It's an odd trade, as someone said, to sacrifice your brain for fleeting pleasure or relief. Ultimately, the true way out of the current mental health crisis, which is tragically exacerbated by our modern diet of processed foods, pervasive social media, constant negative news cycles, this polarized culture is through a focus on fundamental brain health. It's about recognizing that brain health is a skill. It's a muscle you can train. And it's infinitely easier to cultivate happiness, focus, and resilience when your brain is actually functioning well. My personal mission is to contribute to ending the traditional concept of mental illness by sparking a global revolution in brain health. Because when you get your brain healthy, your mind will inevitably follow.
This has been a truly, truly enlightening deep dive into this revolutionary world of brain health. We've explored everything from the power of cutting-edge brain scans to the everyday habits and profound insights that can genuinely transform your well-being.
Understanding your brain through this lens of functional health really empowers you, the listener, to make informed, proactive choices for a better present and a healthier future. It's not just a one-time fix. It's really a journey of continuous discovery and continuous improvement.
We truly hope this deep dive leaves you not only better informed, but also profoundly inspired to ask yourself that crucial question every single day. What choices will you make today that are good for your brain? Until next time, stay curious, stay informed, and keep making those good brain choices.